April. My name is Ashley and this is Brennan. We're both transplant dietitians here at Children's. The information that we're about to go over will also be reviewed post-transplant if appropriate. So the first topic that we most of the time go over with our patients post-transplant is just steroids and their relationship with nutrition. There are several side effects of steroids when we're talking about kind of food and patients eating. So we can see increase in appetite, we can see an worsening or increase in water retention. We can also see some alterations in some kind of lab values such as cholesterol. And then we can also see lower absorption of calcium, potassium, and an increased excretion of magnesium. So we may notice some kind of altered labs post-transplant that maybe our patients aren't quite used to. The second big topic that we go over are our food safety guidelines, and we have a handout that's associated with this as well. I like to say basically the most important part is kind of washing your hands, washing the counters, just kind of really focusing on proper preparation, storage, and then reheating of the foods that you're eating. So making sure you're not eating anything raw or undercooked or super kind of expired or past date. I always say if it smells bad, you should throw it out. Just when in doubt, throw it out in our transplant patients. And then we will also provide you with kind of a table if you are a family that likes to cook a lot of protein products or grill out a lot. Using a meat thermometer to cook to the appropriate temperature is recommended.
So another topic that we will discuss after transplant is fluids. We will establish a fluid goal for you. So it will be important to meet that fluid goal every day just to make sure that your kidneys are flushed well and that everything looks good from a laboratory standpoint. So for your fluid goal, this will include non-caffeinated fluids. So juices, water, and also if you're taking in any formula or nutrition supplements. And this goal may change as we look at labs and look at urine output. So this is a flexible goal, but fluids are a big thing that we push post-transplant. So after transplant, for our PO eaters diet advancement, the goal is to get to a regular diet. We may have to use some electrolyte restrictions until the kidneys kind of wake up after transplant. So we may have some potassium, sodium restrictions, but the goal is to get to a regular diet. And if appetite isn't so great after transplant, then we may use some nutrition supplements like a Carnation Instant Breakfast, Boost, Ensure, or any products like that. And then for our patients who use tube feedings, post-transplant, you will likely be on a different formula if you've been on a renal electrolyte limited formula before transplant. So we may use a more food-based formula. So we will also kind of move along from continuous feeds, which are kind of easier on digestion post-transplant, and move to a bolus feeding schedule that more mimics meal times.